Yemen has announced its first case of coronavirus. Yemen, of course, a war-torn country, a country where much of the population is already suffering. Joining me now, Philippe Lévêque, head of CARE France. Hello, thank you very much for your time. Now, Yemen's healthcare system is already crippled. So what happens if the virus spreads?
Well, thank you for calling. I have no idea. Nobody has any idea. If the system collapses, then the pandemic will go very rapidly. But we are trying to, all of us working in the International Alliance of NGOs are trying to get ready. We have some stocks available, some products. We try to do some prevention measures and to instruct the people how to do a social distance if they can. And wash, hygiene, sanitation measures to limit the contamination. But it will be horrible.
Of course, social distancing and washing your hands several times a day is very difficult for a great number of people around the world. Are there particular zones, areas that you're particularly concerned about right now?
I'm concerned for all the zones, Our group of NGOs working together, CARE, of course, but Médecins du Monde, Doctors of the World, Action Against Hunger, and others. We share a lot. We coordinate our efforts. I'm very concerned about urban areas with high density, but of course, obviously, they can't do any social distance and must have access to some work and buy some food daily. So urban zones are terrible. War zones, as Yemen you mentioned, and South Sudan, Central African Republic, for instance, are difficult, and not to mention the Venezuela and all the people who have left Venezuela going to neighboring countries, Colombia, Peru, Ecuador, where the health system is already in shambles.
So what would you like to see the international community do right now to help these poorest of countries?
We need a lot of money, a lot of new and additional money. I'm concerned that, of course, there will be support from the international community, but they will reallocate some areas, some pockets of money that they have assigned for international aid, and that money will be missing for the other health programs or the basic education programs that we do, or the emergency response that we do in Yemen or Syria, for instance. We will certainly hope that local governments, national governments, will allow humanitarian personnel to contribute to the response. We have some examples already in Madagascar where we meaning Doctors of the World, Action Against Hunger and CARE, have been asked by the mayor of Tananarive, the capital city, to train their staff on measures and prevention actions. And from the international community, we hope that we shall be able to send humanitarian personnel as soon as possible from our own countries, from Europe, from the United States, from Japan, from China, to the zones where they badly need a more medical or non-medical staff. And that's an issue, of course, traveling.
Of course. I'm afraid we'll have to leave it there. Thank you very much indeed for everything you do. Thank you for your time, for joining us here on France 24. Philippe Lévêque from CARE France.